Nigeria, a nation with a vibrant and diverse population, faces critical challenges within its healthcare system. Our documentary embarks on a compelling journey to uncover the deep-seated challenges faced by stakeholders within the health sector. As we delve into the heart of these issues, we uncover the stories behind the statistics and give a voice to those affected. With a population surging towards 200 million, Nigeria faces an alarming shortage of medical practitioners, losing its skilled healthcare workforce to the allure of better opportunities abroad.
Okay, we look at what the number of years you've spent, what you are getting, and if you go to another a developed nation that yes, I can get better in terms of pay, then why not? Then I should migrate in a way. And there are some that we also want to migrate, not just because of that, but because of even technology as well to that. Okay, if I have the right equipment to practice, then in a way it also help my own practice. And for those who also like to publish or researchers, okay, so that means I can do a lot with the technology to write, to publish, and to give my contribution in terms of contribution.
As the World Health Organization recommends a minimum of 1 doctor per 600 people, Nigeria needs about 237,000 doctors, but has only about 35,000. The stark reality is mirrored in the World Health Organization's Health System Performance Ranking, where Nigeria stands at 187th out of 190 countries, a ranking that is not just about statistics, but about the well-being of a nation. Beyond the statistics, Nigeria grapples with challenges that resonate deeply: outbound medical tourism, insufficient medical infrastructure, low government budget allocations, and the immigration of skilled healthcare workers. The economic toll is profound. Nigeria loses at least $2 billion annually to medical tourism. In the face of these challenges, we turn to those directly impacted. We'll hear from patients who've suffered losses due to inefficiencies in the health sector, and healthcare professionals limited in executing their duties due to systemic challenges.
The job that is available is much more than the people that are engaged. People that are taking care of other people. You don't make them happy. You pay them less than what they are doing. You should change them. Do you still expect best from them? So many of them got frustrated, and they felt that the only way out is to check out of the country. And that would mean that we are reducing the labor force, that we should take care of our people here. Diagnosis is very important in medical care.
The major challenge that we face in this country is the shortage of medical personnel. Like where I work now, in that place is a primary health care setting that we need like maybe 15 personnel, but presently we are 5, and we are running 3 shifts. So the workload is too much on us. Most of us, we are falling sick. And that is the reason why most of our people, they are, jackpot, everybody was just going out that they cannot kill themselves.
If you look at the way patients, when they come to facilities, they are patients, the setup, that you see people sitting under the sun, waiting to see a doctor. And in terms of equipment, you're surprised that yes, you get to the theaters, that yes, you see old instruments still in use. You go to some government hospitals, you see the analog facilities, and you can imagine in states, there are some states that they don't even have what we call CT scan, that you need to go to another state. And if you go to developed countries, you just see those things. If you visit 10 hospitals, there's the possibility of you seeing CT scan, everywhere. And unlike us that we find it difficult to see in general hospitals, serving in local government, but over there you see it even in community hospitals. So in a way, those infrastructures and equipment, they are not easy to come by.
Not only that, you are working with less experienced doctors. When the experienced one are out of their position, you may do with what you have. I cannot be the same. And the less experienced do not have experienced one to work with, to be mentored.
And once fatigue sets in, they try as much as possible, like, let me clear my desk, and in a way there could be a form of misdiagnosis as well too. So due to that fatigue, the other thing is the fact that yes, if you are supposed to work as a team and you don't have the critical, the important team members in that team, you can imagine if I'm the one functioning as a doctor, I'm also the one trying as much as possible to ensure that yes, the nursing care too, I'm also providing in a way, because we only have a nurse in that unit, and she's also busy with patients, or with clients in a way.
I have two scenarios. Number one, lack of transportation, that we need to refer. I work with one of the primary healthcare settings, and we have a protocol. We call it two-way referral system. So the one that we cannot handle, they have to transfer the case to the secondary level. So when I need to refer a patient and I don't have any transportation means.
For example, you don't have handle bag that you need to use for a baby that you know, yes, okay, let me quickly resuscitate this baby. I need to also improve or increase the airflow into the land. You don't have the handle bag. So in a way, you are frustrated. You know what you are supposed to do, but you are limited based on the available equipment. If you look at infrastructure now, most of the infrastructure which you expect in terms of now the equipment that you also need to support your diagnosis or to also work with, they are not available. Even when they are available, they are obsolete. You see that yes, in advanced countries, that some of these equipment are no longer in use. Then now go to the major one, which is in terms of financing. Once you don't have a robust system in place to help healthcare financing, then in a way it also affects the provision of services, not just on the part of the people providing it. As I said, it also affects infrastructure, the people providing the services, the equipment, even on the part of people coming to receive as well, so as they will tend to start paying out of pocket. And paying out of pocket on its own will also affect the quality of services that they also will get to receive. Because once they cannot buy they can't afford the type of service or services that you want to render, then in a way, you want to go around it to ensure that yes, they still get a form of care, but in the real sense of it, it's still not the best form of care or service that you would have loved to render for such clients.
To me, I feel like they were so nonchalant. I don't even know. I don't understand, because why would a doctor not be on seat by that time? Nobody was there. They were just doing anything they like. No human sympathy, no feeling. Everybody, that was why.
Àwọn dókítà tán ní bóyá owó tán san fún wọn kéré ló jẹ́ kọ́pọ̀lọpọ̀ wọn máa travel out. Tàbá ní dókítà ń san máa ṣe máa ní ká dúró ni. Wọ́n ṣe fẹ́ tó bá wá dúró ìgbà wo lẹ̀mí òfin ní ìgbà lẹ́nu ẹni tá gbé wá bá, kò sí equipment tó lọ rẹpẹtẹ. Fẹ́ oògùn, kò sóògùn. A máa ṣe máa wá tòsí ta tó ti fẹ́ rògùn náà ní tá bá tó mówó dání. So kí wọ́n láǹfààní wípé àpè hospital ní hospital ìjọba. So kò sí àǹfààní náà. So kán jọ kán bá wa wá nǹkan ṣe sí. So torí àwọn kan bá wà bóyá ẹ̀mí bá ń ṣọ́ọ̀tì, ẹ̀mí ń lọ lásìkò tí ò yẹ kó lọ. Nígbà tí ó bá sí dókítà tó yẹ kó ètè attend sí yàn. Àwọn bóyá ẹnìkan dókítà bíi mẹ́rin ti wà lórí ẹnìkan. Ó dẹ̀ yẹ kó pọ̀, kò yẹ kó yẹ pé iye dókítà kan tó yẹ kó wà lọ hospital rẹ̀. Wọ́n á ṣe ní kẹ́ dúró, báwo lẹ̀mí ò ṣe ní bọ́lá rẹ̀ nínú bí ìtẹ́ gbé wá. So wọ́n á pè bìkan lẹ́mọ̀ emergency tẹ̀ dé tó yẹ pé wọ́n á kọ́ dá yín dúró, wọn tí ní dókítà tó máa dá yín lò. Ṣé emergency ni? So kí ìjọba wá nǹkan ṣe sí, kán jọ kán bá wa wá nǹkan ṣe sí. Kò sí nǹkan kan tá a fẹ́ ṣe sí, tá a bá gan tó mọ́wọ́ ojú máa ń ti owó ń gbà mí mọ́ wa lọ́wọ́. So kán jọ kán ṣàánú wa.
As we conclude this exploration, we extend an invitation to all. Join us in the pursuit of a healthier, more resilient future for Nigeria. Let us collectively bridge the gaps, heal the wounds, and ensure that every citizen has access to the quality health care they rightfully deserve.